Welcome to this explainer. Today, we're diving into something absolutely crucial, literally the foundation of the human experience, our ability to communicate. But more than that, we're going to talk about how our dedicated team at American Wellness Center is helping adults reclaim that ability. You know, communication drives our personal, social, and professional lives. When it's compromised, the impact is just profound.
Have you ever felt totally trapped behind your own words? In our clinical experience at American Wellness Center, this is actually the most heartbreaking challenge for our adult patients. It's this deep, profound isolation of knowing exactly what you want to say in your head, but being physically or cognitively unable to get the words out. It's a silent struggle for thousands, but here's the good news. You absolutely do not have to face it alone.
So, what does this actually look like day to day? Well, what we consistently see with the patients we support are some very specific frustrations. Maybe it's struggling to be understood by your own family or dealing with chronic hoarseness. Sometimes it's swapping out correct word sounds for incorrect ones, or even experiencing really terrifying episodes of choking while eating. These aren't just minor hiccups. They serve as crucial indicators that a speech, language, or swallowing disorder is present and, frankly, needs professional support.
Now, to tackle these challenges, you need a solid foundation of trust, and that's exactly what we've built. Since we opened our doors back in 2016, right here in Dubai Healthcare City, American Wellness Center has been delivering evidence-based, truly compassionate care for these exact communication hurdles. We've created a real sanctuary for healing over the years, grounded in clinical excellence and ethical practices.
And we certainly don't do this alone. We are incredibly proud of our multidisciplinary team of over 60 highly qualified Western-trained clinicians. We've got 20 different specialties under one roof. What that means for you is that we work collaboratively to treat the whole person, not just a single symptom. We're bridging that gap between mental and medical health to look after every facet of your well-being.
All right, let's move into Section 1, the science of communication root causes. To figure out how to treat these barriers, we first have to look at where they come from. Often, speech and language afflictions stem from major neurological events, things like strokes, traumatic brain injuries, or progressive conditions like Parkinson's disease. These events basically disrupt the brain's ability to coordinate communication. But we also frequently work with adults managing lifelong conditions like cerebral palsy, genetic disorders, or even learning disabilities that somehow went undiagnosed for years.
A critical distinction we frequently explain to our patients during their very first visit is the difference between speech mechanics, language processing, and vocal quality. A speech disorder, that's about the physical sounds, like stuttering or articulation issues. A language disorder, on the other hand, means you're struggling to find the right words, use grammar, or process a conversation. And a voice disorder is all about the pitch, volume, and quality, which often leads to vocal strain or fatigue. They're totally different puzzle pieces.
Let's look at a real-world medical scenario to put this into perspective. Aphasia and dysarthria. Many of the stroke survivors we treat actually experience both of these conditions at the exact same time. Aphasia hits the language center, meaning the words just won't come to mind. Dysarthria weakens the physical muscles of the mouth and throat used to speak those words. Because these are two distinct neurological hurdles, our speech-language pathologists use highly targeted therapies to strengthen both cognitive processing and muscle coordination simultaneously.
Moving right along to Section 2, our comprehensive clinical approach. So, how do we actually go about treating this? Well, we firmly believe there's absolutely no one-size-fits-all solution. Your journey with us always starts with Step 1, a comprehensive assessment. From there, we build Step 2, a personalized treatment plan that is completely unique to your specific goals. Then comes Step 3, the actual targeted therapeutic exercises. And finally, Step 4, where we make sure you succeed with home practice routines and ongoing progress monitoring.
Depending on what that initial assessment uncovers, your therapy sessions, which usually run about 30 to 60 minutes, are highly customized. For instance, we might focus heavily on cognitive communication strategies to rebuild memory and problem-solving after brain injury. Or, on a completely different note, we might use accent modification and clear speech training to help corporate professionals refine their workplace communication and really boost their confidence in the boardroom.
Next up, Section 3, Beyond Words, Voice and Swallowing.
Our work goes way beyond just spoken words, branching into two entirely different but equally vital therapeutic tracks. On one side, we have professional voice therapy. This is for folks who rely on their voices every single day. Teachers, presenters, performers, helping them resolve that vocal strain. On the flip side, we handle critical dysphagia management. Dysphagia is a swallowing disorder that can lead to choking or malnutrition after a neurological injury. This therapy is quite literally life-sustaining, ensuring our vulnerable patients can eat and drink safely.
And that brings us to Section 4, Moving Forward, Your Journey to Thriving.
So what is the ultimate outcome of engaging in all this hard work? The real-world benefits are honestly life-changing. By addressing these functional communication and swallowing deficits, we are actively restoring your confidence, we're restoring your safety, we're reducing those frustrating daily misunderstandings, and most importantly, giving you back the ability to easily connect with the people you love.
Every person deserves not just to survive, but to truly thrive. I can't emphasize this enough. At American Wellness Center, this is our core philosophy. It guides every single assessment we do, every exercise we plan, and every clinical milestone we get to celebrate with you. We aren't here just to help you manage a condition. We are here to watch you flourish.
Which brings us to our final thought. Communication is way more than just an exchange of information. It's the very bridge connecting us to our humanity. When that bridge is damaged, you don't just lose words, you lose a piece of yourself. So if you've been trapped in silence, isn't it time to rebuild that bridge and allow yourself to thrive? Our specialists are here and ready to support you. Thank you so much for joining me for this explainer, and we really look forward to welcoming you to the American Wellness Center.